Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
I thought that I'd just introduce the subject of pain and exercise a little bit, and I'm going to leave the main part of the topic to Sharmi to discuss with you about specific exercises for back pain and back problems. I found this slide, and this is way back before medical schools were open. There were anatomists that were trying to learn how to what the human body was all about, and they came in their plain clothes, as you can see. And I can imagine the speaker explaining that what the muscles look like when people don't exercise. But having said that, that is how we learned our anatomy, by dissecting. Just very briefly, I was going to talk about the benefits of exercises in degenerative disc disease, scoliosis, obesity, prevention, osteoporosis, and chronic pain management. And these are the things that actually are helped tremendously by someone getting into an exercise program, not just specifically an exercise program for the back. And Sharmi is going to spend time telling you about the anatomy of the spine and techniques of exercising. And specifically, we'd like you to pay attention to the Legacy Strength Training Program that is at the Washington Outpatient Rehabilitation Center. It's a program that was developed out in Florida, and she'll tell you more about it as time goes on. The benefits of exercise. Well, we know that when you exercise, you burn calories, and when you burn calories, it lowers your blood sugar. It certainly helps obesity prevention as you burn calories. If your caloric burning is more than your intake of calories, then you will definitely lose weight. It does improve the power of the muscles, and this becomes very important because the studies have shown that after the age of 50, most people will lose about 15% of the power in your muscle, in your entire body. And after the age of 70, you lose about 30% of it. And this can be reversed by regular exercise. As the power in your muscles improves, your balance improves, and therefore we hope that there will be fewer falls in the home environment. Fewer falls means prevention of fractures of the hip and fractures of the wrist and other parts of your body. We know for sure that if you exercise regularly and if you get into a program where you're actually using your muscles to pull things and lift things, that the bones will get the information that they need to remain strong. So it preserves the calcium and other minerals in your bones, and therefore it prevents osteoporosis. It also controls pain. So when we exercise, there are chemicals that are released in the brain that are called endorphins. They get released in the spinal fluid, and they go and latch on to these receptors within the brain. And it does block pain. And many of my patients who have taken up a program of exercises, even though they were experiencing chronic pain, find that they have an improved quality for at least 2 to 5 to 6 hours after they've exercised for that day. The endorphins are made by amino acids, and so if one does have chronic pain, just as a sidelight, you ought to increase the protein content in your diet, having a little bit of protein with breakfast, a little bit of protein with lunch, and a little bit of protein with dinner. And if you do that, you have the ground substance for releasing these endorphins. Well, if you eat the proteins and you don't exercise, you won't release the endorphins. So it becomes important in that sense. If you do exercise regularly, you also adjust the levels of serotonin and dopamine in your brain, and it does counteract depression. And what we have noticed is that patients who have chronic pain, they start to develop atrophy of a part of the brain that is called the prefrontal lobe, which is the part right in front. And it is possibly the reason why people in chronic pain, well, the frontal lobe of the brain is responsible for you doing the right thing in society, and you're courteous and you're kind and so on, because the front part of your brain is very active and you have a conscience. Well, people who are in chronic pain often get impatient and irritable, and it may be that some of those defense mechanisms that normally inhibit you from being inappropriate are lost as you develop atrophy of that portion of your brain. Your circulation improves, and the circulation to the brain improves, and then therefore you prevent atrophy from developing. Just very briefly, currently, patients with low back pain, there are approximately about 3 to 6 million Americans that are on permanent disability because of their backaches. And backaches will affect at least 50 to 80% of American adults at some time in their lifetime, at a rate of about 2 to 5% per year. And some of these non-surgical causes of back pain are strains, disc bulges, disc degeneration, which then results in facet arthritis. And as you exercise less and you have a backache, you do less. So your back hurts more as you increase weight bearing. Just a very brief note on the degenerative cascade that occurs as your spine, as we get older. And if you herniate your disc, or even if you don't herniate your disc, there are age-related changes that occur in the facet joints. The joint capsule becomes, you get an inflammation of it, which is called the synovitis, and that's part of the degeneration. The capsule becomes loose. The spine starts to slide. That's the meaning of subluxation. One vertebra is sliding forward on another, and the articular processes themselves become arthritic and big, creating pain. The age-related changes create this dysfunction, herniation, instability, and sometimes the nerves can get trapped, resulting in spinal stenosis. And of course, as time goes on with your different activities, if you actually hurt the disc and develop tears in the disc, it disrupts the inside of the disc gets resorbed, spurs develop, which is the other name for osteophytes. All in all, you have a very poor quality of life coming on. These pictures show the normal spine on the left-hand side, and just below that is a degenerated spine. And you can see the spinal canal. This is the spinal canal and the normal spine, and in the degenerated disc, this disc, which is very healthy, has become worn down. It's bulging out and encroaching on this canal, which then causes pressure on the nerve. This part of the spine is called the ligament. There's a ligamentum flavum, which starts to enfold inwards, and it narrows the spinal canal. And this is off to the side. Here in the normal area, that's the opening through which the nerves run, and it becomes very, very small from this calcium spur developing and the joint developing this arthritic change. So that's what traps your nerves. So This is the normal process of disc degeneration that occurs. Now, we can't really stop ourselves from degenerating, but if you start to develop the degeneration, if you exercise the muscles that support the spine, you'll do better overall, and you can slow down the process. I threw the slide up just for this one in the corner to show you how many nerves there are around the facet joint and around the discs and such. So you can imagine why, when you have a spinal condition, why you start to hurt like crazy. These are x-rays of what happens when the disc degenerates. That's a normal disc, and this is a disc that's wearing out. And that's a side view of a normal disc and the disc that's wearing out because of the disc degeneration. And what we want you to not have is have an implant put to reestablish the space. We want you to try and avoid the surgical procedure that is done to try and correct some of these problems. And you can do that. This is just an MRI scan that shows what happens as the disc degenerates. The spinal canal becomes narrow, and there's compression on the nerves. The vertebrae start to misalign themselves, and that creates some difficulty. The next thing that is benefited by exercise specifically is osteoporosis, and it's really critical that exercise be initiated. Osteoporosis is basically low bone mineral density. It can create fragility fractures. That means you can do some very trivial lifting, bending, and falling in your home, and you can fracture your vertebra very easily. This is what an osteoporotic bone looks like. On the left side is the normal bone, which nice, thick calcium bridges, and this is the osteoporotic bone that occurs as you lose calcium. And you can reverse this process by medications and by exercise. This is what happens to the hip. Similar changes, and to the spine. When you do develop osteoporosis, vertebral fractures become very, very common. And if you have one vertebral fracture occur, you become 4 times more prone to have a second one. And if you have 2, then you get 10 times the risk of fracturing another vertebra. This is the same lady who developed progressive osteoporosis and kyphosis with shortening of her height. And this is basically just x-rays of what the compression fracture looks like, which is this one here. So the development of osteoporosis results in back pain, spinal deformity, decreased lung capacity, and so on and so forth, until you end up having poor quality of life, increased risk of fractures, and the mortality rate goes up too. And these are things that can be reversed by regular exercise and watching yourself. These are slides from Alameda County from 2007. And in our county itself, we have between the ages of 18 and 39, 22.9% are overweight and 21.8% are obese. And between the ages of 40 and 64, 35.6% are overweight and 25% are obese. So you can see that about half our population is significantly got a problem going on. So we need to emphasize exercise with weight reduction. And this is in children, 7th and 8th graders in Newark, Fremont, Hayward. The good thing about this slide is that the percentage of overweight children is going down, particularly in Fremont. The lower level is from 2006-2007 statistics, and the upper line is from 2008 and 2009. So we are making headway with our younger population, and we would like to make similar headway with our adult population. Obesity, you can imagine that if you have a pronounced weight gain, this and your entire body weight is on the lower spine, that you start to degenerate your disc, and if you're misaligned, you're going to have a lot of pain, and that slip is going to get worse. The misalignment is going to look far worse than what it is. Just another picture of the misalignment. Scoliosis is important. Many years ago, when people didn't live quite as long, we would see scoliosis in people that was very slight, and we didn't worry about it too much. But now that our population is growing older, there's a baby boomer generation that is living longer. What we are seeing is adult scoliosis is progressing. It means people had a very mild curve 10 years ago, and over the course of 5 to 6 years, the curvature of the spine has been becoming much worse. Now, this ties in to this concept of losing power after the age of 50 and additional loss of power after the age of 70. If the support muscles of your back are getting weaker and weaker, the curve in your spine, if you have scoliosis, is going to worsen. And as a result of that, the intensity of your back pain is going to go up. So it is an important thing to correct with an exercise regimen. And that's what a normal spine looks like from the back, and a scoliotic spine looks like from the back. So with that, I'm going to turn the talk over to Sharmi so that she can introduce you to what our program calls for. Thank you.
Hello and welcome to our lecture on back care. I'm truly honored to be here today, and honestly a little nervous to follow Dr. Erasmus, but I'm going to try my best. I'm going to talk about some very basic anatomy, biomechanics of the spine, and some very basic exercise that you can do at home without any equipment. So to begin with, I'm just going to give you some statistics, and Dr. Erasmus actually kind of spoke about this, but back problem is one of the most expensive musculoskeletal disorder in industrialized nations, with US being affected the most. It is seen that at least 90% of the entire population will suffer from low back pain at some point in their life. And it's probably true because I think most of us have had back pain at some point or the other. So when you say low back pain, what does that mean? When does the upper back end and when does low back begin? What functions does the low back perform, and basically what components does the low back consider? So this is the components of the spine. The basic components are bones and joints, muscles, connective tissue, which is also ligaments, nerves, and spinal segments. So this is the basic anatomy of the spinal column. It consists of 33 vertebrae, out of which 7 are cervical, 12 thoracic, 5 lumbar, 5 sacrum, and 4 coccyx. Now the sacrum and the coccyx are basically rudimentary vertebrae, which means they are fused vertebrae, and they don't have something called the disc. So now when your doctor tells you you got a problem at C7 or L1, you know what they're talking about. It's the level of the spinal column that they're mentioning. Each vertebra has the same components, but they are slightly different in size. For example, your cervical vertebra is obviously a lot smaller than your lumbar. Having said that, each vertebra has the same composition though. It has the same disc and has the same structure. And the spine has a natural curve in the cervical and the lumbar area, which is called lordosis. As you can see in this picture right here, there is a little curve, and that curve is very important to maintain correct alignment, and I'm going to talk about that a little more when we are talking about posture. But this is a natural curve, and it's present in your cervical and your lumbar area, and that's very important to maintain. Now, I'm just going to give you a little brief introduction about what the disc is. Now, I'm sure everybody here has heard of either disc disease or disc degeneration. What is a disc? So this is what actually a disc is. The disc primarily makes up at least 1/4 of the length of the spinal column. They are the thickest in the cervical area and the lumbar area, mainly because these two areas have majority movements that happen in the spine. The outer ring, which is this one, it's called the annulus fibrosus, and it covers the inner jelly-like substance called nucleus pulposus. Now, the nucleus pulposus is primarily a jelly-like substance, and it has very high water content. With aging, the water content reduces and it becomes more cartilage-like. Now, when you do have a force put on the spine, it's the nucleus pulposus, which acts as a shock absorber. Now, if the pressure on the spine is more than what your annulus fibrosus can handle, this ring is going to rupture. Now, you can see the spinal cord is right here. So what happens is when this ring ruptures, the jelly-like substance comes out and pushes on the spinal cord. That is what we called a disc bulge. And if it is completely out and pushing on the cord and the nerves surrounding it, that's your disc herniation. I'm going to show you some more slides here. So this is your ring-like structure, and this is the jelly. When this ring explodes, the jelly will come out, and this is your spinal cord. And you can see the nerves here passing by. They will compress the nerve, and that's when people have sciatic pain. You know, you can't explain it, but it goes all the way from the back to your leg. And this picture here, it shows you how the disc is basically cushioning between the two vertebrae. Now, muscles. So that was your vertebrae, now muscles. And muscles is something very important. Flexibility and mobility. Joints allow flexibility and muscles allow mobility. There are so many small muscles in the back, each controlling some part of the total movement between all the vertebrae and the skeleton. These muscles can be injured directly. For example, you know, when you pull your back, when you're trying to lift something, or just turn around when you're sleeping or working out. The muscles can also be in spasm without any direct injury to it. What is muscle spasm? When you experience a muscle spasm, it is because the muscle tightens up. These spasms usually occur as a reflex, meaning that you cannot control the contraction of these muscles. You actually don't have any control over them because they automatically go into spasm. When any part of the spine is injured, for example, a disc, ligament, bones, the muscles automatically go into spasm. This is also known as protective spasm. So it's how the body's defense mechanism works. The muscles go into spasm to prevent further movement of that area that is injured, so you don't further injure that part. That's how we are made. That's the muscles protecting the rest of the spine, which is actually pretty cool. All right, muscle physiology. I'm sure everybody here has had a muscle spasm at some point in their life. And it does not necessarily have to be the back. It could be the leg, it could be your hamstring, it could be your calf. What causes the muscle spasm? When muscles are in spasm, they produce excess of the chemical called lactic acid. Now, what is lactic acid? It's basically a waste product produced when a muscle contracts. It is produced by the chemical reaction that occurs inside the muscle cells. Now, if the muscle cell cannot relax and is in spasm, there is too much lactic acid buildup. Now, it is this lactic acid that causes the burning sensation that you feel when your muscles are sore. For example, you go to the gym and work out after, 15, 20 days, and your muscles are sore. It's because there is excessive lactic acid production that you feel that soreness. Now, the main reason that lactic acid builds up inside the muscle cells is when the muscle contracts. The small blood vessels traveling through the muscles are pinched off. So just imagine you have a tube and you're trying to pinch it between your thumb and your finger. The same thing happens to our blood vessels. The circulation in that area stops. Now, when the muscle relaxes, the lactic acid is eventually washed off because the circulation in that area again improves. So muscle spasm will cause increased production of lactic acid, which in turn will cause more pain. I hope I was able to explain that. Okay, moving on. We're talking about abdominals and core. I'm sure everybody hears the word core strength a lot these days. So what is your core? I'm not going to talk about all the abdominal muscles, but I'm going to talk about the important ones. So the first one being rectus abdominis. You see that? 1, 2, 3, and on either side. This is your six-pack. Rectus abdominis is a deep muscle of the abdominal wall. It helps in flexion of the trunk, which is forward bending, and stabilizes your pelvis. Then you have the transverse abdominis, which is to the side right here, and it is again on each side. It is the deepest of the abdominal muscles, and it functions to support the abdominal wall and provide stability. Now we talk about muscles of the back. First, we have the quadratus lumborum, which is right here. I'm not going to talk about origin, insertion, nerve supply. I'm just telling you what the basic muscles are and how they help us and why it's important to maintain strength. So this muscle is a deep muscle of the back. It helps with side bending when you're reaching to the side and elevating your hip. Then you have the psoas major. It is located at the anterior hip, which is right here. It goes all the way down. Again, it is used for side bending of the spine, and psoas major is also a hip flexor. So you see a lot of these muscles have two functions. It's not just working on the spine, but it's also working on your hip. And then you have the iliacus, which is right here. So this is your hip bone and this is your spine. So this is all connected between your spine and your hip joint. Now the iliacus, which is right here, the wing-like muscle, works along with psoas major to stabilize the trunk. So these muscles all have a lot of work stabilizing our trunk. Now, muscles of the back, and these are the most important back extensors, we call them. And when you are in therapy or when you're going through your legacy strength training program, these are the muscles that we basically focus on because they're so deep. And there are so many, as you can see, so many that we really have to focus on strengthening them. So first we have the erector spinae. So I'm just going to go slow with this. You have the spinalis, longissimus, and semispinalis. These three together form your erector spinae muscle. Together, these muscles function to extend the spine, that is bend backwards and side bend the trunk. Then you have the multifidus, which is right here, and it's really deep. Multifidus is a very important back extensor, and there's a lot of research that has shown that strengthening the multifidus actually takes care of your back pain. And we actually have a machine at Washington Outpatient Rehab that specifically focuses on the multifidus. It's very hard to isolate that muscle. As you can see, it is a vital segmental stabilizer and is bilaterally active with the same side or opposite rotation. So it doesn't matter which side your body is rotating, this muscle is always active. I just wanted to give you an example of the various ligaments we have around the spine. I'm not going to go in depth. Just to show you, this is the anterior longitudinal ligament and this is the posterior. The posterior is a lot weaker than the anterior. Just to give you an idea that a lot of time back pains is also because of ligamentous strain. And that usually happens when the ligaments are stretched beyond their means. Common causes of back pain, and Dr. Erasmus kind of touched base with a lot of different causes, and I am just mentioning the ones we see a lot in the clinic. Of course, there are more, but these are the most common. Muscular strain, everybody knows that. Ligamentous sprain, herniated disc causing radicular pain, spinal stenosis, and osteoarthritis of the spine. Now, Dr. Erasmus showed you a lot of cool slides about X-rays and MRI. I'm just going with animation. Okay, so this is the normal disc. We just spoke about how the disc functions, so it's separating the vertebra above from the one below. This is degeneration. You can see how it's beginning to get thin. Now this is a bulging disc, which means the jelly-like substance from here has come out, trying to compress the cord because your cord runs through here. This is herniated disc, which means it's completely out and definitely compressing the cord. Then you have the thinning disc, and then this is degeneration with osteophyte formation. Okay, this is my best part. Posture. So I kind of explained how the anatomy works. Now let's talk about posture and back pain prevention. So I have a quick question for the audience. Who all here spend at least 50% of their time during the day sitting? All right. How many of you are aware of your posture while sitting, or how many of you sit like this? Okay, you don't have to answer that, but I'm just saying, because I do it all the time too. Be aware of your posture at all times. We can prevent a lot of back pain just by maintaining correct posture. Sitting, you can see from this picture, oh my gosh, look at his spine. We just spoke about that curve, right? The natural curve that we have, it's right here. Yeah, look at his curve. So slouching posture during sitting causes excessive thoracic kyphosis. Kyphosis is this posture that's going on here. And straightening of the lumbar lordosis. So the curve is lost. Can you imagine the pressure on the disc? It's not normal anymore. Obviously, this person is going to have some kind of back pain. Okay, now you can answer. This is kind of pretty easy because the exclamation marks over there. So you can see his spine here, and then you see that curve, that's normal. Again, see how she's sitting, you see that curve. She could be better, but not bad. I just had to add this. So correct posture, which is this, versus physical torture. Look at that spine. Which shall survive? I think everybody knows the answer. Okay. Now, a lot of times we have chores or jobs where we are required to be in the same position for a long time, and it's very hard to correct our posture. Here are some tips I'm going to give you to maintain the correct alignment of your body. So for example, if you have a sitting job, go ahead, get a lumbar support. Get a pillow and just put it back here. You don't even have to go buy the exact lumbar support, which costs, I don't know, $200. Just get a pillow and just support the curvature. Just have something here so you're maintaining your curve. Again, when you're doing chores and it's hard to maintain that correct alignment, just shift your body weight from one leg to another like she's doing. Then after, 15 minutes, switch it to the other leg. So your spine is not, going through all that pressure of standing in a wrong way. You're actually reducing the weight bearing by switching legs. Okay, lifting. You see that electric shock on his back? This is bad. This is the right way to do it. Use your knees. Maintain your lordosis of the spine. That's a new word everybody learned today, lordosis. Maintain that curve and bend your knees. And just basic physics. This is lifting, this person is lifting a huge weight. The distance between the weight and the body is huge, which makes the lever much larger than normal, which puts a lot of effort on the back, plus you have gravity acting on it. Similarly here, use your knees. Now I know some people will tell me, oh, I can't use my knees, I can't bend them as much. That's fine. Hold on to something, bend your knees, and then lift. And make sure when you're getting up, whatever you're lifting is really close to your body. Here, let me show you one more slide. Ooh, you see that? This is the right way to do it. Hold it close to your body. Again, hold it close to your body. You might lift it right, but then when you go to put it somewhere, you're again extending too much. Make sure it's always really close to your body. You're reducing your base of support. Okay, this is carrying. This is the right way to do it. You're holding it close to your body. This is bad for your back. Again, correct way of lifting. Ooh, bad. I have had a lot of 16 and 17-year-old patients of late complaining of back pain and neck pain, primarily because firstly their backpacks are too heavy, which I understand, I've gone through school. And secondly is they like to just hold it on one side. Well, the backpack was primarily made to have it behind both your shoulders. So you need to make sure, whoever you're giving advice to after this, that they know that the backpack has to go across both shoulders and not one. Okay. I just asked everybody, which superhero do you think of when you talk about strength? And everybody in the clinic said, oh, Superman. I said, okay, I'll get Superman up there. I'm not going to guarantee you'll have muscles like Superman after doing those exercises, but for sure you will have a stronger back and core. Now these exercises are mainly for the general population who do not have any back condition or have had abdominal surgery. If you do have any of these conditions, please refer to your physician, surgeon, or therapist before you do them. The goal of having these exercises is so you can do them at home, at your spare time, without any equipment. So we're going to start with the first one. It's called the basic bridging. Lie on your back with your knees bent, so that's your starting posture. And then you lift your waist towards the ceiling gently and hold it for 5 to 10 counts, which means 5 to 10 seconds, whichever is comfortable. Now, main thing about these exercises are, please don't hold your breath, okay? That's not going to work. So what you want to make sure you do is, when you're holding it for 5 counts, and I tell this to all my patients, is keep your mouth open and just count it loud so it forces you to breathe. Because it's hard to breathe and exercise at the same time, I know it. So just keep your mouth open and consciously make an effort to breathe, okay? Next is single knee to chest. Again, start on your back with your knees bent. Pull one leg towards your chest with your hands, keeping the other knee in bent position. And then you repeat it again up with the other side. Again, if you want to hold it for 5 to 10 counts, that's fine. Or if you can do it longer. Planks. Starting position is you lay on your stomach with elbows bent to 90 degrees, keeping your knees straight. The knees are straight over here. End position is you raise your belly from the mat and hold it again for a count of 5 to 10 seconds, maintaining the 90 with the shoulder and elbow. This is very important. Modified push-up. You can kneel with arms straight and hands on the mat as shown in the picture. So the modification comes here because the knees are bent. In a regular push-up, the knees would be straight. Keep the back straight. It's very important that you don't arch your back. She is arching a little bit, so this is not perfect, but keep the back straight and perform a push-up. Now for people who think this is too easy, you can go ahead and do a regular push-up. The special instruction, I have it over here, says keep low back and trunk stable in a neutral position. Oh yeah, there we have the Superman exercise again. Lie face down with arms outstretched overhead as shown, so those arms are straight out, and then you just arch back, raising arms and legs off the floor. You can do these whenever you want at home. I would recommend performing 2 sets of 10 repetitions, maybe once a day. If you think you can do better, go for it. It's completely your call, and I would say always listen to your body. If it's too much, start with 5 repetitions and then go from there. But these are very basic core and back exercises that you can do at home, maybe on your bed or your mat, surface that is very steady. So those exercises were basic strengthening. Now I'm going to move on to some more strength training that we are talking about. And as Dr. Erasmus was constantly reinforcing that I'm going to be talking about the legacy strength training program that we have at the clinic. What is strength training is something we need to talk about first. These were examples of exercises that you can do at home safely, but there are other options out there for strength training and maintaining the health of your back and core. So we have different kinds of strength training techniques. One is weight training that you do at the gym with a trainer or without a trainer. It's up to you. Resistance training on gym equipment, isometric training, plyometrics, Pilates, and slow motion exercise. Now, legacy strength training is or follows the concept of slow motion exercise. What is resistance exercise benefits? Before I move on, I just want to tell you that you will be seeing a lot of slides of our trainer, that's Leon. He runs the strength training program, on different equipments. Now these equipments are from the rehab center. We have 11 of those machines that we use for the legacy strength training program. I could just get 5 slides because I couldn't capture the others, but make a note of the machines that are there at the side because they all individually work on different parts of the body. Resistance exercise benefits, and Dr. Erasmus spoke about that. The key to developing both strength and flexibility, more efficient way to burn calories than aerobic exercise, develops lean muscle mass, metabolism speeds up, and burns calories even at rest. The health benefits. Improves bone density, joint function, increases muscle, tendon, and ligament strength, reduces potential for injury, elevated HDL, which is your good cholesterol, and increases levels of serotonin, norepinephrine, and dopamine. And Dr. Erasmus did talk about this for the chronic pain and the depression patients. Reasons for strength training include, honestly, I don't think you need a reason to strength train, but anyways, being out of shape, overweight, being excessively tired, to look better, and I think everybody wants that, diagnosed with osteopenia, diagnosed with osteoporosis. So now I'm going to talk about what is slow motion strength training. So till now we were talking about benefits of strength training, and now we are focusing on the slow motion section. What is it? What does it consist of? 20-minute sessions a week or more, depending on the client. Duration dependent on time and convenience. Raising and lowering weights in 10-second intervals in each direction. Specialized machines, which I was showing you the pictures of, provide support and isolate targeted muscle groups. And this technique avoids jerky and momentum-aided motions. So you are basically going really, really slow, and hence the name slow motion. What makes this program special? What is it that we have to offer at the Washington Outpatient Rehab? We provide one-on-one supervision with the trainer to ensure safety, comfortable, non-distraction-free environment. And plus, we're all very nice. So, slow motion exercise requires you to get the rest your body needs. So work out only 2 times per week maximum. It can also just be once a week. the body repairs itself between sessions. You have time to enjoy the things you like to do. Like, you don't have to do strength training, every day. You can do yoga, you can mix and match whatever you like doing. And the 4 essential variables that makes this program stand out are high intensity, so you are pushed to your limit, and hence the one-on-one sessions. Minimal workout sessions, which is 2 sessions weekly, and it's really short. You finish your session between 20 to 25 minutes. And continuous client progress. We actually document your progress every time you come in, and we have seen that clients progress at least every week with weights, intensity, and we have a stopwatch to see the duration too. Strength training is for everyone, all ages, any gender, and any physical condition. And the reason I say that is we have a pregnant woman in the picture, which means it's okay for everybody to go through it. Those that should not attempt this high-intensity program are those with health problems who need to seek the advice of a physician, beginners, and people who are in rehab. We have started screening the new clients who come in. When I say we, I mean the physical therapists will be screening all the new clients who come in for this program from here on, just to make sure that they're safe to go through the program. And that is our contact information, and to find out, you can add your name to the growing list of success stories. That is the phone number down there and the address. And I think I'm done for now.
Hi, I don't have osteopenia, I don't have osteoporosis, but I've lost 3 inches. And I don't like it because I weigh the same thing I weighed when I was 5'3". I mean, when I was 5'6", and now I'm 5'3", and it's not fair.
Do you want to address that?
Well, you can drop in height just because of a change in your posture. So as your spine becomes a little bit more kyphotic, and as the discs lose some of their hydration, you will drop in height. So that is possibly one of the reasons why that might happen. You might grow taller with exercises.
Might an aging mattress that possibly needs replacement be a cause for back pain?
Oh, absolutely. What happens with your spine is that as you get older, these joints become a little bit arthritic. Your ligaments become a little more rigid, and your spine becomes a little bit more rigid. So if you get into a mattress that kind of torques your spine or twists it or bends it in a certain way, you will wake up with a backache.
Center, do you have, what are your, I guess the doctors on staff? Is there one for arthritis, and then there's one that just does the spine work? You have, it's a fine line between if it's arthritis, you go to the arthritis doctor. If it's the spine, you go to the spine doctor. So I'm just curious, how do you handle it in your spine center?
Actually, our spine program encompasses everyone that practices at Washington Hospital. So we have physical medicine and rehabilitation doctors, PMRs. There's, I think, 3 or 4 of them in Fremont, and they do the non-surgical management of conditions of the back. And that includes things like trigger point injections and such that are pain modalities. Then we have our 3 neurosurgeons that all do spine surgery, and predominantly connected with the surgical treatment of spinal conditions. But also, we are also involved in the non-surgical management of back conditions. And we have one orthopedic spine surgeon that's also a part of our program. So we incorporate everybody, but we're not under one roof, so to speak. So it depends on where you get referred to.
You mentioned degenerative disc disease and thinning of the disc as well as a ruptured disc. What are the different symptoms between those various maladies?
So generally, disc degeneration usually results in back pain. And when a herniation occurs, it presses against the nerve, and that usually causes pain in your back and one that travels down your leg and causes a combination of numbness and weakness of your lower extremity. Having said that, if you have advanced degeneration at one particular level and you develop a lot of arthritic change in your joint and your ligaments become very thick, then you develop this condition called spinal stenosis. And spinal stenosis causes weakness in your legs. So after you stand for a period of 5 minutes or 5 to 15 minutes, or if you walk for 5 to 15 minutes, you get the sense of heaviness and weakness that happens in your legs. And the moment you sit down, it goes away within about 30 seconds, and you wonder if you're crazy. But that is a real symptom of spinal stenosis. And if you start to develop symptoms like that, you ought to have an MRI scan done just to see how good or how bad it is. Very mild spinal stenosis, we can get you into the exercise program and stop the progression of the condition, if you will. Whereas very moderate to advanced spinal stenosis, there are minimally invasive surgical procedures that have come out nowadays called the X-stop insertion and different things that we do that are not as extensive as what we used to do 10 years ago that are available.
What is that X-stop procedure?
The X-stop is where we implant a little titanium metal piece between the parts of the spine that are called spinous processes, and it spreads the two bones apart and opens up the canal through which the nerve runs out to your leg.
Thank you.
And you can Google that.
I have another one up here.
Yes, my doctor says, my heart doctor told me that being my age that I shouldn't have nothing done because I'm 86 and I got a lot of stuff wrong with my back. I got almost everything you've said here. So he says being I'm old, it might be worse if I operate. Plus I have two shoulder tears in my shoulders.
Oh, we got to find something for you.
Any other questions? Oh,
Here's
there's
one.
a hand over here.
This is not really a question for the speaker, but you mentioned the X-stop. Does anybody here have one? I'd love to talk to somebody. Oh, I'd like to come talk to you after this is over.
One more question here.
I'd like to know how successful the X-stop is or can be.
Okay.
I mean, is it like an epidural?
No, it's actually a surgical procedure that is done as an outpatient. I mean, you get to go home. The procedure lasts about an hour and a half, and we do send you home the same day or certainly by the next morning. A device is implanted, and it relieves the pressure on the nerve. Now, having said that, this country continues to produce new technological advances. So the X-stop was developed or began development in San Francisco at St. Mary's Hospital in 1996 and was released by the FDA in 2006. And it took 10 years of really hard clinical trials to become, to be released and to be useful. And it is useful. Over the last 2 years, there have been two new devices that have come out that are like the X-stop, but they actually clamp your spine. So that what the X-stop does is it allows some movement of your spine, to remain behind, whereas these two other devices that are implanted very much the same way, they freeze the movement in an open position, and they actually fuse your spine in a minimally invasive manner. And that's one is called the Aspen because it was developed in Aspen, Colorado, and the other one is called Fix because it was developed in San Diego, and that's the name that they choose. So there are a lot of things that are happening in the spine field that are surgical that we're trying to make minimally invasive and try not to hurt people in the process. Success rate is probably, I would say that about 80% of patients who have the X-stop placed are pleased with their result. 20% still have to come back and have it converted to the regular operation because it didn't work or didn't provide enough relief of pressure on the nerve. Okay.
Is there a test to know if you already have permanent nerve damage?
Usually we ask our neurologist friends to do a test called an EMG nerve conduction study, and where they put little electrodes into your muscle and they see for an injury pattern, and if it's positive, then you know that you've got nerve injury, and they can tell whether it's recent or whether it's old.
Well, let's thank Dr. Erasmus and of course Sharmi Mukherjee.